Athlete injuries are common. They can happen during practice or competition. These injuries can be minor or serious. It is important to manage these injuries properly. Proper management helps athletes recover. It also helps prevent long-term problems. When injuries are not managed well, they can worsen. This can lead to chronic pain and reduced mobility. Athletes may even have to stop their sport. This video will explain how to treat athlete injuries. It will cover prevention strategies. It will also discuss returning to sports safely. When an injury happens, act quickly. Immediate action can make a significant difference in the recovery process. The first 24 hours are critical. This is the window where proper care can prevent further damage and speed up healing. This is when you should follow the PRICE principle. It's a simple yet effective method to manage acute injuries. PRICE stands for protection, rest, ice, compression, and elevation. Each step plays a crucial role in the recovery process. Protection means to stop the activity immediately to prevent further harm. Rest the injured area to allow the body to heal. Ice helps reduce swelling and numbs the pain. Apply ice for 20 minutes at a time. Do this every 2 to 3 hours to keep the swelling down and manage pain effectively. Use a thin cloth between the ice and your skin to prevent frostbite and skin damage. Compression also helps with swelling by limiting the amount of fluid buildup in the injured area. Use a bandage to wrap the injured area snugly but not too tight, as this can cause more harm than good. Elevation means raising the injured area above the level of your heart. This helps reduce swelling by allowing fluids to drain away from the injury. Keep it above your heart as much as possible, especially during the first 24 to 48 hours after the injury. After first aid, further treatment may be needed. This is often the case when the injury is more than just a minor sprain or bruise. Immediate care can only do so much, and the next steps are crucial for a full recovery. This depends on the injury's severity. A thorough examination by a medical professional will determine the best course of action. They will assess the extent of the damage and decide whether more conservative treatments will suffice, or if more intensive interventions are required. Over-the-counter pain relievers can help manage minor injuries. These medications are often the first line of defense against pain and inflammation. These include ibuprofen or naproxen. They are widely available and can be very effective in reducing discomfort and swelling. They reduce pain and inflammation, allowing the injured area to heal more effectively. However, if over-the-counter options are not enough, stronger medications might be necessary. Your doctor might prescribe stronger medications. These could include prescription-strength anti-inflammatories or even opioids in severe cases, but these are used with caution due to potential side effects. Physical therapy is very important. It plays a critical role in the recovery process, helping to restore function and mobility. A therapist will guide you through exercises tailored to your specific injury. These exercises are designed to strengthen the affected area and prevent future injuries. These exercises help you regain strength and flexibility. Consistent practice is key to making a full recovery and returning to your previous level of activity. They also improve range of motion, which is essential for performing everyday activities and sports movements without pain or restriction. Modalities like ultrasound or laser therapy can be used. These advanced treatments can accelerate healing and provide additional pain relief. These help with pain relief and tissue healing. They are often used in conjunction with other treatments to enhance overall recovery. In some cases, surgery may be needed. This is usually considered when other treatments have failed or when the injury is too severe to heal on its own. This is for severe injuries like ligament tears or fractures. These types of injuries often require surgical intervention to properly repair the damage. Surgery helps repair the damage and restore function. The goal is to get you back to your normal activities as quickly and safely as possible. Rehabilitation after surgery is crucial. It ensures that the surgical repair heals correctly and that you regain full use of the injured area. This phase can be lengthy but is essential for a complete recovery. Section 4. Preventing injuries. A proactive approach. Preventing injuries is always better than treating them. Warm up before every workout or game. This prepares your muscles for activity. Cool down after activity to prevent muscle soreness. Flexibility is key to avoiding injuries. Stretch regularly to improve your range of motion. Strength training is equally important. Strong muscles provide better support and stability. Use proper technique in your sport. Incorrect movements can increase injury risk. Rest and recovery are crucial. Give your body time to repair itself. Section 5. Returning to the game, a gradual and safe process. Returning to your sport too soon can be dangerous. It's crucial to understand that rushing back can lead to severe consequences. It increases the risk of re-injury, which can set you back even further. Listen to your body and recognize the signs it gives you. Start slowly and gradually increase activity. Begin with light exercises and progressively build up. Don't push through pain. It's a signal that something isn't right. Your doctor or physical therapist will guide you through this process. They have the expertise to create a tailored plan for your recovery. They will tell you when it's safe to return to play, ensuring that you don't rush back prematurely. They will consider your healing progress, monitoring how well your body is responding to the rehabilitation. They will also consider your sport's demands, understanding the specific physical requirements and stresses involved. Returning to play is a step-by-step process. Each stage is crucial, and skipping any can jeopardize your recovery. Be patient and follow your healthcare provider's advice diligently. Their guidance is key to a safe and effective return to your sport. Thanks for watching, and please remember to like, comment, and subscribe.